Welcome, everybody. This is cats.com live stream. Oh, wonderful. Wonderful. I have a question. Yay. Let's throw it up there. Let's make this a little bit bigger so I can see it. So I'm actually going to have to get out my old lady glasses here, which is very sad, but it is what it is. Jack, chronic kidney disease cat, sdma and BUN normal. Okay, let me think about that for a second. Creatinine 2.6, unsteady on legs as if dizzy the day after subq, but fine the following day. Is this normal? No. Nope. What about this? What about the disclaimer? The disclaimer, I already gave the disclaimer. Highly volkish, you missed it. This is for educational and entertainment purposes only. You use all of this advice at your own risk. Okay, so Jack has a question here about another chronic kidney disease. Guys, I have to tell you, I will answer these questions about chronic kidney disease, but I have to tell you, as a veterinarian, very frustrating to me. I'll tell you why. Because we have all these drugs to treat it, and yet we haven't figured out why it happens. Are these cats going into kidney failure in the wild? Right? What's going on with these cats? So anyways, this person, so they have their cat in for subq fluids. I would say definitely not normal. Unsteady on the legs as if dizzy the day after. Not normal at all. So what's going on? Not sure. Could be electrolyte imbalance. Could be anything. But what I would do, Jack, is I would talk to your veterinarian about this, let them know so they can note it in the medical record. And then if it happens again after the subcutaneous fluids, take a video and then send it to your vet and say, hey, what's going on with this? And if your vet is anything like me, they'll go, that's not normal. You need to come in. We need to figure this out. Okay. Okay. Let me see if I can figure out how to all right. Roberta Flores. Okay. So thank you so much for my moderator putting up resources in the chat. Nocturnal asthma. You guys did all miss my my disclaimer. I was in here all by myself for like 2 minutes, and I was like, "Where are all my people? Where are you guys? I'm all alone." So I was talking to myself, but now you're all here, so really happy. So happy to see some people that are repeat offenders. I see you guys in the chat, so thank you for being here again. It really means a lot to me. Here we go. Another question. Also, I brought my old lady readers just so I can make sure to get your names because it's very tiny on my screen. So we have Erica G. Can a cat have cancer and not lose weight? Absolutely. Absolutely. Cats can definitely have cancer and they cannot have any changes in their weight. What causes cats to lose weight with cancer? A couple of different things. It's usually because the cancer is consuming too many calories. So cancer can steal calories from any body, not just a cat's body, human bodies as well. And so if your cat is losing weight, that could be a reason. Other reasons that cats lose weight when they are having some type of cancer, if it affects their appetite at all, causes it to go down. So it's either decreased calories going in or increased utilization going out. But they can have certain types of cancer, such as squamous cell carcinoma, which is the most common skin cancer in cats. It's usually on their face, on their ears. That one usually does not show up with any kind of weight loss. Okay. I see the host is putting something up about the technical issues. I was thinking it's technical. I was like, did they just not like me last time? What's going on? Okay, so here we go. Torty. Tootie. I am so sorry. I think it's not Torty. It's Toddy. I gotta get my eyes checked, man. Is it normal for cats to throw up frequently? You might think so because some cats are chronic vomiters, but no, it's not. Now, an occasional upchuck, and when I'm talking occasional, like once a month, maybe, and maybe it has fur in it, so it's a fur ball. But in general, not a thing. Not allowed. Chronic vomiting is not normal. If your cat is chronically vomiting frequently, then that means that they feel terrible and they need to get that checked out. Okay, I'm going to have I'm going to move on over here to some pinned messages that my beautiful Mallory, who is backstage right now. Hi, everyone say hi to Mallory. She's here. She has put some up for me. All right. Helene, hello, my friend. I've seen you before. I think I'm going to have the struvite stone removed via surgery, 15-year-old female. Do you know anything about laser surgery versus regular surgery? I do. I think laser surgery, if you can afford it, is a better option. And let me tell you why. Because lasers, when they are used in surgery, reduce the amount of inflammation and trauma to tissues because they cut more cleanly. So animals experience less pain and they heal more quickly. So especially on a 15-year-old kid, you want them to go through as quick as possible. Also, this is talking about a surgical laser. I don't know if you're asking about post-operative lasering, which is when they use a cold therapy laser on the skin after surgery. That is also a good idea, and it's usually not very expensive to have that added on. And again, what that does is it reduces inflammation, reduces swelling, helps the tissues heal faster. So if you have the option, I would recommend laser surgery. Ooh, here's a great question. Hopefully I don't get in trouble for answering it. Okay, here we go. Lagatica has a wonderful question. Do indoor cats need their boosters? 4 and 1 in rabies, even though they never go out of the house. Okay, well, I'm going to give you the tea here. I'm going to talk to you like I'm talking to a friend, right? So what you're going to find is vets are all over the map on this. Some people are absolutely no, some people are absolutely yes, and then there's the whole spectrum of care in the middle, right? So when people ask me this question, just as a veterinarian, I say, do they absolutely need them? They do not need them. They're not going to die without them. Do they need them if it's like a legal requirement in your area, which is different all over the planet because humans are different all over the planet? Yes, in order to be legal, in some places you do have to do it, right? Especially if you're in like an apartment building, sometimes they have special requirements for animals in those areas because it's higher density and there's more likelihood that these animals can catch infectious diseases from each other. Now, here's the tea. Here's where we are just friends, okay? What we have found is a lot of these vaccines, they are lasting a lot longer in these animals than we previously thought. The 3-year vaccine period is based on an average, based on titers, how long we're seeing titers last in these animals that show that they have high enough antibody levels to protect them. If you have a concern about how often you are vaccinating your cat, you have a couple of options. The best option is to speak to your veterinarian about having titers checked on your cat, because then they can actually determine the level of antibodies your cat has to whatever disease they're being vaccinated against. If they're high enough, then you don't need it. I do know that most places, rabies vaccine, because it is a disease that can be transmitted to humans, is required by law for dogs. It's different in cats. It's not always the same thing in cats everywhere. So check your local jurisdictions and rules. If you don't have any legal requirements, you can talk to your veterinarian about having titers. There are several different titer companies in the United States, at least, that can let you know. I actually had some cats that were my patients that were sensitive to their vaccinations, and it made them very, very ill. So we ended up checking titers on those cats. Then there's a whole question about, well, they never go outside. They're never going to be exposed. Why do we need to do it, right? So I say it's based on your comfort level. Remember, you are in the driver's seat of your pet's health, not me. I am here to advise you. I'm here to guide you. I'm here to share my knowledge and my tools with you. I am not here to make you feel bad or do exactly what I want you to do. I'm here to advise you. You are in charge. I have had clients that when we have this conversation, I say, well, do you want to discontinue vaccines in your indoor only, otherwise healthy older cat that never ever goes outside or goes anywhere? And they say yes. And I go, okay. And then I write it in the medical record because it's their choice. Now, if you are taking your cat to a veterinary hospital, remember there's always possible exposure to infectious diseases there as well. So, I mean, basically anywhere you go, you have a risk. But if the cat never goes anywhere, and even better, if you bring a veterinarian to your house to do the services for you, it's up to you. It's your choice. Okay. Now, you always do run the risk of infectious disease. But again, personal choice. My personal choice, I had a 10-year-old doodle dog. And at that point, I was like, I'm not going to do anything other than rabies anymore. I'm just not. So again, that might be a little bit of a controversial answer, but I'm talking to you as if we're friends. We're hanging out. And I'm just sharing with you all the different options and information that's out there. Okay, I got let's see, here we go. Ooh. Okay, great question from Nocturna Astro. Once in a while, I catch my girl with rapid breathing while she sleeps. Should I be concerned? She was a panleukopenia survivor when she was 8 weeks old. She is now 1. So panleukopenia is a retrovirus in cats and typically attacks their immune system and their GI. It's very similar to parvo in dogs, kind of the same class of viruses, basically. So the normal breathing rate for cats while sleeping, I'm actually making sure I have my numbers correct. So the normal respiratory rate for cats when they are sleeping is 20 to 30 breaths per minute. Now, it could go as low as 15, it can go as low as 35. When this happens, is it possible that she's dreaming? Right? Is it any possibility that she is having a dream that is causing her to if this only happens every once in a while and she's otherwise normal, healthy, happy, I wouldn't worry about it. If you're worried about it on any level, you know what I'm going to say. Talk to your veterinarian. Now, some cats can have what we call occult, which means hidden heart disease. The most common in cats is hypertrophic cardiomyopathy, which is where their heart muscle gets thicker and thicker and thicker, and it just doesn't move blood. It doesn't beat or move blood very well. Oftentimes, we don't know that cats are having this issue because they don't have the typical heart murmurs or anything like that. Sometimes their only sign is that their energy level's a little down. They're not eating very well. Maybe there's some vomiting. It's kind of weird. It's kind of like heart attacks in women. It's strange. So if you are worried and you're noticing, so what I would do is I would just check it every single day. And then I might, just make a little spreadsheet and just record what the resting respiratory rate is of your cat while she's sleeping. Hopefully it's a she. And then I would just maybe send an email or whatever, talk to your local vet and say, hey, this is what I've recorded at home. My cat's otherwise healthy. You know my cat. You've listened to my cat's heart. What do you think? Okay, great question. I catch it maybe once a month if I'm lucky. That's not very often at all, but it could be happening when you're not catching it. And I never like to scare people or fearmonger or anything, but I've been burned and I have said, it's no big deal. And then it ended up being a big deal later down the road. So it's awesome. And, you can also just record it on your phone, right? Just make a little note, put it in the notes of your phone, put the date, put the respiratory rate, write it down. And it could just be that she's dreaming. Okay. Congratulations on having a beautiful panleukopenia survivor. All right, Alex. Alex has a beautiful question about cats mourning. I got my old lady readers out. Are cats affected by the passing of one of the cats? We had one of our cats pass away a couple days ago, and you're worried about the 3 other cats. Yeah, so cats form very tight social groups, and it definitely can affect the other kitties mentally and emotionally, right? Cats have feelings. They do. And I know this group of people understands that. So is there a grieving period with the other cats? Yeah, there can definitely be a grieving period with other cats. So just also if they were all together in the same social structure, and here's the weird thing about cats, they can they can be in the same house, but be in different social groups, cats. But if they were all part of the same social group, there's going to be a little reordering of that group as well, that group hierarchy. So make sure to give your cats a lot of space, give them love when they want it. Make sure they each have places for themselves to rest, have their own resources. Each has their own food bowl, water bowl, toys, litter box, bedding, right? Each of them. So because they're going to have to figure out who's in charge. So yes, it can affect them. You may notice some behavioral differences in your cats. Just give them some time and some space. 9 times out of 10, they figure it out. Miss Davis. Ooh, interesting. Miss Davis has an interesting question for me. Please, ideas for my cat that wants to eat and does eat all day and night and doesn't gain weight. Used to eat normal, but this has been several years. Normal labs for everything, including thyroid and kidney. So normal blood glucose as well. And then when you had the thyroid panel run, did you have the full panel run or just the T4? Because T4, which is the hormone, thyroid hormone in cats, can be normal, but it's actually not normal. And that's called, here's my fancy word for you guys today, sick euthyroid syndrome. So a cat that is hyperthyroid, and that's generally older cats, hyperthyroidism generally only shows up in older cats. But they can have it and have normal thyroid results come back. It's why when you go to the doctor, they want to run the whole thing, T4, free T4, TSH, all the T's, all the T's. So make sure a full panel was done on your kitty. Also, I would catalog actually how much your cat is eating per day. I would just try and measure it out and then see how much that cat is actually consuming. Because if that cat is consuming normally, if that cat is consuming more than the normal amounts of calories, then, sorry, I was reading the comment come back up again. If they're eating a lot, but they're actually still consuming between 270 and 330 calories per day, that might seem like they're wanting to eat a lot, but they're actually eating the normal amount. So I would have a full thyroid panel done, the whole thing. I would also make sure blood glucose is normal as well. Then I would make sure that cat is see how many calories are actually going into that cat per day. And then I would speak to your local veterinarian and say, this is exactly how much my cat is eating every day. This is how much my cat weighs. Is this a normal amount for my cat to be eating every day and not gaining weight? And do you have any health concerns? Because it could be that your cat is just bored. A lot of indoor kitties, they'll just eat and eat and eat because they don't really have very much else to do. So, and then they eat to get that little dopamine hit, those little feel-good chemicals that they get when they're actually eating. So hopefully that helps to get you started. And I'd love to hear follow-up about how much that cat is actually consuming per day. And then make sure you get the full thyroid panel done. Question? This is an interesting question. Can cat food influence the color of my cat's fur? I have no idea. I do think in some of the cat foods, they are using like natural things like, I'm not going to say it right, carrageen, that can have some colors that might influence the pigment in a cat's skin, but typically I would say no. That was what I would say. Treatment for cat acne from my good friend Roberta Flores. Excellent question. Cat acne is when it's on the chin, basically. And what happens is they get what looks like human acne. So they get redness, they get pimples. Sometimes they'll get ones that actually pop and have pus. They'll get blackheads. And it can be really unsightly. So basically, this is typically an allergic reaction to the type of bowl you're feeding them out of, plus a bacterial infection. So make sure you're feeding them out of a stainless steel bowl, and make sure you're washing that bowl every day and run it through the dishwasher a couple times a week, right? Wash it with soap and water because you want to take the bacterial load down. Then the best thing to do, depending on how severe it is, some cats will actually need treatment with antibiotics to get it under control. Other cats they can do just fine with a topical treatment. There are medicated wipes that you can get from your vet that are antibacterial, and you just wipe them on there like once a day, twice a day. And then 9 times out of 10, that takes care of it. Every once in a while, this is an allergic reaction to something in their food. So if you clean up your food bowl situation, make sure it's stainless steel. Make sure to treat with those medicated wipes, and you're still seeing a problem. Could be something else, like a food allergy, or it could be even external parasites like mites. Less likely to be, more likely to be the bacterial thing. With my older clients back in the day, I used to tell them, just go to Walgreens and get your over-the-counter Stridex pads or whatever generic Walgreen medicated wipe that they're having out there. 9 times out of 10, it's the same chemicals that's in the veterinary formulations, and use that. But to be super legit, I need to recommend the Duoxo products to you. Douxo. They have a wonderful medicated wipe. See if that clears it up for you. Okay. Ooh. 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 Interesting. Okay. Chris Rinaldi. My cat had a really bad case of gas that caused him to vomit constantly through the night. My vet said he just had a case of gas. Is there something I can do to prevent him from getting a lot of gas? Well, again, this one's a little bit difficult to, and we've got Chris. Okay. Chris, this is a little difficult for me to chat with you on this because it's kind of like when people ask me, they say, hey, my dog's coughing. What do you think's going on? And I'm like, well, it could be like 40 things, right? So for gas in cats, it could be anything from they ate something that was spoiled and didn't agree with them, so that they just had one case of gas, or it could be intestinal parasites, or it could be a small intestinal bacterial overgrowth, which is when the gut bacteria is just, it's out of balance and you got too many bad guys and not enough good guys. Could be an infection with a bacteria, which happens. Could be a reaction to something that they're eating, like an autoimmune reaction. Could be an inflammatory bowel disease. I don't know. There's a lot of moving factors here. So one thing you could try that is not going to hurt, I think, in any way, is you could try getting them some probiotics. And I like the soil-based probiotics, if possible, the sporulated type. And then Purina also does have their Fortiflora products, which I always love because they put a lot of research into them. You could try giving some probiotics and see if that doesn't help reduce some of the gas. You can't do Gas X or Beano or anything like that. And then also make sure that your cat gets a clean bill of health otherwise from your vet. I always want to know why. Why is a cat getting gas? What's going on in there? So I would start with a probiotic if I were you, and see if that doesn't help a little bit. Some people also have some success with canned pumpkin, just adding a little bit of fiber to the diet, like a teaspoon of canned pumpkin. And as my beautiful people who are here right now advised last time, make sure it's just canned pumpkin, not canned pumpkin pie filling, because pumpkin pie filling has sugar in it. I'm making sure that I got all of the questions in the chat. I did. Oh gosh. Oh gosh. Okay. So Here is a question from Trisha. My kitty has little bumps on his nose. Could it be acne or allergies? Probably not acne or allergies per se. So it's not acne because cats just get the chin acne. If it's bumps on the nose, could be, it's an inflammatory process, but it could be a couple of things. I used to have a cat growing up that every mosquito season would develop a severe, would get bit by mosquitoes on their nose and then would always get this big ulcerated wound every single year. During mosquito season, it would come and then it'd be gone. So it could be a reaction to mosquito bites. Could also be something I mentioned a little earlier in this. It's not a webinar. We're just streaming live. So whatever this is that I mentioned a little earlier ago, which is squamous cell carcinoma. Not to scare you, but it's skin cancer in cats, and it shows up on the tip of the nose, shows up over the eyebrows, shows up on the tips of the ears, those kind of not so haired parts of their face. And just like in humans, it comes with several different levels of severity. It comes from like precancerous to, oh my God, what's going on? What if it is something like that, it's most likely precancerous. You can get it lasered off, burned off, frozen off. Lots of options. Talk to your vet. All right, one more question. Stephen, are there new drug therapies available for IBD cats that cannot be managed by diet instead of the deal with the devil of long-term low-dose prednisolone that can lead to diabetes? Yeah, definitely. So as far as treatment for cats, obviously, Stephen is aware of the things that are bad about long-term use of steroids. What it can cause is it causes hormonal imbalances in their system that can, as he said, lead to diabetes. And that is like not good. We don't want that, right? So he's asking if there is any other options out there that have showed up since then. I would say some cats are being managed with cyclosporin is another one. And then there fluticasone. So there is the, it's been a minute since I've, hold on, inhalant steroid. Ooh, so flu. Sorry, I'm looking stuff up as we're talking. So So one treatment that I was using when I was in practice was a steroid that is typically used for asthma in humans, but they found that if they give it to cats, it stays in the gut and it doesn't go to the rest of the body, which is exactly what we are wanting. We want them to be able to take a steroid that doesn't go in and mess with their entire hormonal balance, correct? Yes. Yes, Dr. Wooten, that is true. So the first thing to do is make sure that you're dealing with IBD. And don't let anybody tell you otherwise. The only way you can diagnose IBD in a cat is with an exploratory surgery. Yeah, that sounds big and scary. I know. A lot of it's done laparoscopically these days, so that there's a lot less morbidity afterwards. But basically, the only way to diagnose it is to go in there, get a piece of the gut, submit it for pathology. Can you get some ideas from abdominal ultrasound where they measure how thick the intestines are? You can get an idea and you can start them on treatments, but you can't get an actual diagnosis. The other thing, make sure it's not some sort of undiagnosed chronic infection. And I'm talking E. coli, Giardia, Salmonella, Campylobacter, all of those things. And then as far as treatment goes, steroids are still part of the treatment, but some animals are being managed with cyclosporin. And then most of them, these cats do really well if they are on what we call a hydrosylated diet. So it's when they go in and they take the protein, whatever it is that they're reactive to, and then they take it through this process. It's very scientific, and they remove all the antigens from around the protein. So there's nothing there left for the cat's immune system to react to. And then they feed that to the cat. And so supposedly it's supposed to be hypoallergenic. So that is a possibility as well. And I would just make sure that you are actually dealing with IBD in your cat and not something else. And I know no one wants to hear, hey, you need to have exploratory surgery. But if you are really serious about finding out what's going on and getting the correct diagnosis and treatment and not just throwing steroids at it over and over again, because you know the risks, that's the way to go. All right. Nocturne Astro, thank you for saying, oh, thank you for saying nice things to me. I hopefully it's helpful, everything that I said for you guys today. I'm just sharing from my heart. So I hope you guys are well and I've enjoyed my time with you. And please let us know if there's anything else we can do to be of assistance to you. That is all. Let's see here. That's all we got.